another thing that helps me is just trying to bring everything back to gratitude. And I've said this in other talks before, but my mom was the one who really got me started on focusing on gratitude.
Well, hello, everyone. Welcome to the We're Not Stumped podcast. I'm your host, Mike Boland, and today on the We're Not Stumped podcast, I'm joined by Gini Thomas. Gini was at the beginning of a beautiful life. She had just been married to her soulmate for 17 months, and together their life was moving in the perfect direction. But everything changed in August of 2012. We'll learn more about that day and how Gini has navigated some unimaginable challenges to once again find her life moving in a very good direction. But first of all, Gini, thank you so much for taking the time to be on the We're Not Stumped podcast.
Thank you for having me. I'm excited about it.
Not as excited as I am. I met you at the Limb Preservation Foundation Symposium. I believe that was in April, and it was just fun to watch you. You were moderating some boards. You're doing this. You're doing everything. You're having so much fun. So it was great to meet you there. But I want the listeners to learn more about you. So we start the podcast with a segment I call "In Your Own Words." I'd love the listeners to learn more about you.
Sure. So I'm from Montgomery, Alabama, originally. That's where I met my husband. And like you said, we'd been married for 17 months. He had been an avid motorcycle rider his entire life, had made multiple cross-country trips with his dad over the years. And we actually had planned to take a motorcycle trip to go see several Jason Isbell shows up in North Alabama and Tennessee, and take the bike, camp out along the way, make a fun trip out of it. I had not been on a motorcycle in several months at this point. So we got up on a Sunday morning. We were going to go visit his mother about an hour and a half away. Decided to take the motorcycle. We were going to take back roads, take the safe route. We were maybe a mile from our house, going the safe route. We had passed under the interstate, decided not to take the interstate. And a guy pulled out from a side street, ran a stop sign, and just T-boned us. I saw the car coming, but there wasn't really anywhere to bail out because of traffic, the way the road was. So I just didn't have anything to do other than get hit. I blacked out on impact, and I came to sitting in the middle of the street, staring at my femur sticking straight up through my jeans. And adrenaline is a crazy, crazy thing because I remember looking at it and going, all right, that's really bad. And bone is a lot more yellow than I expected. I thought bone was really white, but that's yellow. And this looks like it should hurt, but it doesn't hurt. So I must have some adrenaline going. I'm probably going to pass out. I should start saying things to people. It's so weird how I
Wow.
had all those thoughts. So I looked up from my leg and I saw the motorcycle and it was destroyed. And then I saw Joe, that was my husband, face down in the street. His helmet was still on and mine had been knocked off, but he was not moving, not responsive. And at this point, there was somebody next to me who had started wiping blood off my face. And I kept asking him, can you go see if my husband's breathing? Is he breathing? Do you know if he's breathing? And I think people had checked on him while I was still passed out, because while I was still on scene, I never saw anybody check on him. And then from the way the conversations were happening around me, even though nobody explicitly told me that he was dead, I knew that he was dead. So like I said, was not in pain. I had all this adrenaline. I started spitting out name, date of birth, allergies, anything I could think of to the paramedics. And then they clicked me into the ambulance. And as soon as that gurney was in place, that's when a switch flipped and I started feeling pain. And a needle went into my arm and I passed out. I was unconscious. I was on a ventilator for a week. When I came to, I was shocked that I still had my leg. And I think nobody else knew that I knew that Joe was gone. And they didn't want me to wake up and realize that I'd lost not only my husband, but also my leg. So everyone else made the decision to try to save my leg. First day I was conscious was a Sunday again, and my surgeon came back to the hospital, sat at the end of my bed and said, I'm here for as much time as you need me here. What questions do you have? What can I answer? And I said, I saw my leg and how bad it looked. Like, you think this is going to work?
Wow.
And he said, well, I think you have about a 60% chance of being functional with it again, but it is going to take a lot of surgeries. And if at any point you tell me you're done, you don't want to do those surgeries, if you want to amputate, I'll do whatever you want to do. And at this point, I'd already had 3 pretty involved surgeries. One of them was 13 hours long, just totally reconstructing my leg from hip to foot, metal in every single part. My femur had been broken in 2 places. My whole limb had been dislodged at the hip. My knee was crushed. My tibia was in 9 pieces. They only found 8. My fibula was broken. My ankle was crushed. So, I mean, it was a mess, but since he'd invested all this time in trying to fix it, I said, "Okay, fine. I'll see what happens. I'll do surgeries for a little while." So I did limb salvage surgeries for the next 3 years. Never really gained full function. I never progressed past walking with a cane. I was in constant pain. I got an infection after my 7th surgery that required PICC line antibiotics, and even though I came off the PICC line, they kept me on oral antibiotics afterwards. So all of these medications were ravaging my system. I was in pain. My quality of life was in the trash, like just not happy. So I finally made the decision to amputate my leg above the knee, just get rid of it, start over, close that chapter. So August of 2015 is when I amputated above the knee. And initially, I had a pretty long residual limb. They just went a few inches above the knee, and they left the IM nail in my femur that they had placed to stabilize that fracture. Because at the time, my femur was still pretty weak, and they thought that over time, as I started weight bearing, that hopefully the bone would get stronger. Well, within a socket, sometimes you're not directly loading the bone, and you can lose bone density because of that. Also, the circulation can be a little bit restricted sometimes because of the way things fit. So my femur started to deteriorate at the distal end, and then I had the jagged metal from that nail just digging into muscle belly with every step. So about a year and a half, almost 2 years later, I went back for a surgery to have that nail removed from my femur and cut up to healthy bone. And a few months later, I developed heterotopic ossification, which is fancy jargon for bone spurs. It looked like I had a hook growing on the end of my femur. So that was painful. I went in and I had that cut off, cut up to healthy bone. Well, another one grew. And that process happened, I think, 5 times. And every time I had one cut off, my limb got shorter and shorter and shorter to the point where my limb was so short, it was extremely difficult to comfortably and successfully fit a socket without having to use belts and straps and all that extra uncomfortable stuff. So I just stopped using a prosthesis and I lived on crutches. My limb was already really short. I had another spur growing, and my surgeon said, "Pause. I'm not going to cut away anymore. I think technology is improving. This osseointegration thing is probably going to be more common soon. And if I cut away anymore, I'm afraid I'll take you out of being a candidate for that." So I had my last surgery with him in early 2020. And then the Integrum OPRA Implant System received FDA approval for transfemoral use above the knee in late 2020. So I had a friend in the prosthetics world who reached out to me when a program started in Atlanta, so not too far from me. I went for a consultation in March of 2021. I had x-rays, I had CT scans, blood work, all the things, checking overall health as well as the health of the bone. It took a while for me to be approved because of how short my limb was and because of how weak the bone was, just from disuse for so many years. It had been over 3 years since I'd walked. So they 3D printed models of my limb, and they ran test surgeries on it just to be sure the implant would still work, that the bone was going to be stable enough to support the implant. So consult in March. I didn't have the first surgery until October of 2021. And in that surgery, they're just placing the fixture, which is like the anchor that the osseointegrated implant connects to. Went back in January of 2022 and had the abutment placed. That's the metal part that sticks out of my limb. And then started physical therapy 4 weeks later. Lots and lots of hard work after not walking for so many years. So it took me about 10 months to be able to walk unassisted, and I've been rocking and rolling ever since. So now I get the pleasure of doing some fun things with Integrum, the company that makes this osseointegrated implant, bone anchored implant. I get to travel a lot with them and help educate other people. I get to talk to other patients going through the process and kind of answer questions and provide support and a little bit of mentorship there as
Sure.
well. I'm very, very fortunate that this is how things have turned out for my life.
Yeah, you are an ambassador. And if people want to follow you, I have both your TikTok and your Instagram. TikTok at Gini Thomas and Instagram at Slim Ginny. Am I correct on that?
That's correct. My father-in-law always called me Slim, so I had that Instagram handle way before I even had my neck. I've always been Slim.
Hey, you know what though? At the end of the day, what certainly to honor, I'm sure
Yeah,
your former well, your father-in-law, I guess you can say
yeah.
it. What is it like though to, regardless, you still made your decision to remove your limb. What is the thought process on that?
For me, it wasn't a sad thing at all. I think because I'd already lost the most important thing in my life, my husband, the leg was just really weighing me down. I didn't have an emotional connection to my leg. I didn't view it as life ending. I viewed it as really a restart because the leg wasn't doing anything but weighing me down. And in my mind, if I got rid of the leg, then I could kind of start over and start rebuilding. The only person who was upset when I chose to amputate was my dad. And I wasn't even thinking about it from his point of view. I came home from that appointment all excited. Hey, I scheduled amputation for August 12th. And he just burst into tears. And he was thinking, this is a piece of my baby girl that's going to be gone. I mean, just a totally different perspective from what I had. And I think that was the point where I started to realize this affects more than just me. Like these people have been helping to take care of me this whole time. But selfishly, I was just viewing it as me, my journey. But it takes everybody in your orbit to kind of be on your side and rally around you when things are tough. So he came around, but I just was not expecting that reaction from him. But now he's glad I did it. He sees all of the advantages.
And I read that you had a house with your husband that was a two-story house with everything upstairs. So for a while there, if I read it correctly, you had to stay with your parents for quite
I
a
did.
while.
I did. So my parents had just downsized and built a new house. So they really didn't even have a true space for me, but they made space, brought me home. I stayed with them, gosh, 3 or 4 months right after the wreck. And then I got comfortable going back to my house, navigating stairs on crutches. There were a lot of things that I couldn't do at my house, but it was nice to get back to my own space. And that was a good challenge for me. I would need all of that practice with crutches on stairs in the years to come. So it all worked out.
What was some of the motivation for you to start your social media? Because that could be a scary thing too, because they're gonna judge. There's no question. So
Oh
what was
yeah.
your motivation?
I actually started posting a lot more right after my wreck. Not as much on Instagram, but more Facebook. Because I mean that was 2012. Instagram wasn't as crazy
I wasn't
popular.
even born yet, so.
Yeah, totally. It was so long ago. um, yeah, so I think I started posting more on Facebook because I got tired of having 30, 40, 50 people texting me every day going, how's it going? How do you feel today? What's the update? Did you have another doctor's appointment? So I just started posting everything on Facebook, and then Instagram grew. So I just kind of started cross posting as much as I could. It didn't start out as bringing awareness to any part of an injury or amputation. Things didn't really take off until I had osseointegration done. And I think because it's such a novelty and not many people had seen it, people don't know as much about it, that just gained a lot of attention there. So yeah, weird. The internet's a weird place.
It is, but you do a lot
Yeah.
of great things on there. And I want to remind everyone again, at Ginny Thomas on TikTok and at Slim Ginny on Instagram. You do a lot of education on there, not only there, but you do that through your travels with the ambassador you are with, what was the company name again?
Integrum.
Integrum. I wanted to make sure I said it correctly. I had it written down, but I couldn't find the page quick enough. When you have one hand, you can't flip pages that quick. But what is
Just
that like
try.
being an ambassador with that great organization.
It's really rewarding. And I feel like anytime I'm able to help someone else, selfishly for me, that helps another piece of me heal. And I feel like I've just gotten a little bit better every time I'm able to help someone. Um, for me personally, having other amputees to talk to prior to my amputation was very helpful. I think the more community you have, the better off you are. What works for me isn't going to work for the next person, but I think we should all be aware of what options are out there because maybe it does work for somebody, or maybe somebody takes what I'm doing and they're able to tweak it a little bit and make it even better. And then I realize I can be doing it better as well. So I think just having the community and the network there has been hugely rewarding as well.
Thank you for that. There's some things that I'm developing, and I talked about it on my podcast yesterday. That's like the triple A's of being an amputee or just a limb loss community, the feeling of alone, the need for advocacy, and having a positive attitude. And yesterday I did a deep dive on alone. And even though it sounded like you had a good core of people, there's still that feeling of alone because it's you not against the, well, maybe against the world. What is that feeling of being, did you ever go through that, of feeling alone through your journey?
As an amputee, a little bit. There's certainly times where, your entire core group of friends that you grew up with, if none of them are amputees, they can't relate.
Yeah.
They might try to relate. You meet people who say, "Oh, yeah, crutches, that's terrible. I sprained my ankle one time. I was on crutches for like 2 weeks. I totally get it." No, you don't.
Yeah.
Nah, nice try, but no,
Yeah.
you so yeah, it can be a little bit isolating when you feel like nobody truly understands what you're feeling. And I think phantom pain set that off for me even more. In the early days of struggling with phantom pain, really thinking that I was losing my mind. Like I know my foot's not there, but it's being electrocuted every 15 seconds and I can't sleep, I can't eat, I don't know what to do about it. Like I don't know where to go. So yeah, you'll feel crazy and feel isolated at the same time. But see, that's the positive side of social media sometimes because then you can start looking around. You might find somebody who's tried something that you haven't tried before. Maybe this technique will work. Maybe this medication will work. Oh, soaking in Epsom salts helps someone. Let me give that a try. So yeah, the internet helps. Though it's not in person, but it certainly helps.
Yeah, it definitely helps. And how about support groups? Did you go through any support groups early on?
I I went to a couple of
Yeah.
in-person support groups. I kinda got turned off to them
Okay.
initially because I felt like some of the groups I was going to, it was just people sitting around and complaining,
Yeah.
and I
Yeah.
wasn't getting a positive vibe. Like, yeah, it sucks to lose a limb. It's hard, but what are we doing about it?
Yeah.
There's a lot of good things that we can do. Let's focus on the good instead of dwelling on, well, I'm stuck sitting here today, no leg. I guess I can't get up. It's all a mindset. So I didn't do a ton of support groups early on for that
No,
reason.
I find that we have the same thoughts on that. First of all, when I was younger, there weren't those. But as I've
Yeah.
retired from the company I worked with, and I said, hey, I'm going to start going through two support groups and see what they're like and see if I can offer any assistance. I found a lot of the same thing. It's like a woe is me type of attitude. And that just doesn't jive with how I think. But how did your attitude, how does that make you continue to move forward as you continue to go on in life?
I think the woe is me days are okay. As long as you can set a parameter on it.
Yeah.
So like if I'm having a really, really bad day and I don't know how to pull myself out of it, if I can get to a place where I say, okay, today's bad. I'm going to let myself feel all the bad. I'm going to sulk. But tomorrow I'm scheduling a workout, 8 a.m. I'm getting up. I'm going to start all over tomorrow. I don't think there's anything wrong with that at all. Another thing that helps me is just trying to bring everything back to gratitude. And I've said this in other talks before, but my mom was the one who really got me started on focusing on gratitude. She was still working at the time of my wreck, and she would come home and I'd be complaining to her, this is terrible. My life's over. My husband's gone. I don't know what I'm doing. I don't know who I am anymore. Everything hurts. And she'd say, yeah, I know that's really bad. You've told me all the bad things. Now tell me something good from today. And in that state of mind, like, there's nothing good. Look at my life. It's, what's good about my life? And she'd say, okay, well, do you have a roof over your head right now? Yeah, that's good. Did you open your eyes today? Can you see? Yeah, that's good. You have food to eat. You have good doctors. You have insurance still. You're able to get the care you need. So once you start listing the good things, it kind of snowballs, and the good always outweighs the bad. And that will flip my mindset around every time.
What a great perspective. And you're right, we all have those days, but that's because we're all human, right?
Yeah,
At the
yeah,
end of the day, regardless of how many limbs we have, we're still human. Yeah,
right.
that's an excellent perspective. As I listen to your story and read all about it and see you on social media, you had to go through two different things, the two losses. So, what was it like to balance in your life the two losses that you had?
I Losing Joe was, of course, the worst part of it for me. So I don't think I really grieved the loss of my leg per se. I almost celebrated it, um, because it was, like I said, closing a chapter of pain and getting to start fresh. I get that question a lot. How did you deal with the idea of losing your leg? And I was excited about it. Every time I looked at the painful mess that was my leg, it was just a reminder of the day that the
Mm,
wreck happened.
wow.
And I mean, I can still say that about my prosthesis, I guess, but this is a more positive view that I have of it now. It's not a painful mess anymore. It's a beautiful piece of technology that's allowed me to move forward.
Let's talk about that technology because it is amazing. How does it work for people that are just listening? How does it work?
Let me. I don't. Do people watch these too,
They
or is it
do, yes.
audio?
So
Okay.
anybody that's just listening, we're going to get a demo here really quick, which is
Yeah.
fantastic.
Let's
So
see if
thank
I
you for
can
doing that.
aim my camera down. So I have
Oh,
an
there's
osseointegrated implant. It is anchored in my femur. Most amputees have a socket that fits over their limb. I don't have very much to grab onto.
mm-hmm.
Instead, I just have this implant, and it hooks into this connector
Look at
here.
that.
So it's very easy to put on and take off. It goes on the exact same way every time. It's uh it's quick and easy. I don't have the issue of sweating my prosthesis off anymore. I don't get the skin breakdown or the chafing or the sores. I have greater control. I have greater range of motion without the bulky socket in the way.
Yeah.
Greater proprioception because it is connected straight into my bone. I can actually feel what I'm stepping on. What's crazy is I can feel the difference between surfaces, or like if I step on a tiny pebble or a little cord, I can actually feel that feedback
Wow.
with the prosthesis now, much more so than using a socket where, it's not directly connected. Feelings there have to go through the prosthesis, through the socket, through the socks, through the liner, through the soft tissue, and then you get some sort of a sensation that maybe you're off balance. So this is just a better linkage all the way around.
Thank you for showing us that, and I appreciate that demo. I know there's a lot more demos on your social media at
Oh,
Gini
yeah.
Thomas on TikTok and at Slim Ginny on Instagram. What I read too, another benefit to that is when you have the sockets, your alignment is a little off. Where since this is bone anchored, your alignment is more proper. Is that true? Am I
You
thinking it
you can
correctly?
still achieve a decent alignment with a socket. What's really interesting is, your femurs kind of angle in. When you're standing, your femurs angle in a little
Okay.
bit. When you have a socket, the femur tends to go out side of the socket. So now that you've captured it with the implant, you can have the prosthesis angled directly in line with the bone again. When you're using a socket, even though the bone might be in a different place, you're still trying to angle the prosthesis as it would be. But sometimes that can cause issues with your hip, with your back, just because things aren't in the same place as they're supposed to be. So this allows things to be more anatomically aligned, yes.
That's interesting. What is something that maybe you didn't realize as a person with limb loss that before your limb loss journey, your own, that you realize now that you're going through your own journey?
I did not realize how inaccessible the world is. It's It's amazing to me how many sets of stairs all around the world do not have a handrail. Even I'm in Tuscaloosa right now, the University of Alabama stadium, big football stadium.
Yeah.
There's not handrails on every single set of steps in that stadium. It can be a challenge. So I have practiced over and over and over how to do stairs so that when I encounter a set of stairs without a handrail, I don't get stopped in my tracks. I can still navigate that. There are certain doors that are more narrow and more difficult to get into. So, like when I had to use a wheelchair in between surgeries, there were places I could not go. One of my favorite sports bars, there was absolutely no way for me to get a wheelchair into that bathroom. So it's really opened my eyes to how inaccessible the world can be.
And I know you do a lot in your being an ambassador, not just for the company, but just people with limb loss all over, and people with disabilities all over. And that's what the great thing about your social media. You do a great job on that. What are you looking forward to as you move forward?
Oh, I'm hopefully looking forward to a year without surgeries at some point.
So
So
there has not been a year without, wow, I didn't realize
so
that.
I
Wow.
now the osseointegration has been great. I
Yeah.
haven't had any issues with that, but I continue to have issues, I guess, from the initial trauma. I've had some serious nerve damage. I
Mhm.
continue to develop scar tissue or neuromas on the nerves that remain in my residual limb. So I've had a surgery in February to cut out a rather large neuroma on the sciatic nerve in my limb there. Um, the neuromas can be painful to touch. And a lot of people think that osseointegration takes away phantom pain from neuromas because there's not a socket pressing against it. But that scar tissue can still cause issues with the nerve and send the crazy pain signals. So, yeah, I've had several surgeries for that. Actually, the only year since my wreck that I have not had a surgery is 2016. Um, so, yeah, it would be nice if I could have a year without surgeries.
Yes.
We'll see what happens there. I'm looking forward to helping more people. I am from Montgomery. Like I said, I'm probably moving to Tuscaloosa in the near future. That's where my boyfriend is. We've started building kind of a life here. He's a doctor here as well, not an
Wow.
orthopedic, so totally different. He's learning a lot through me, which is
Yeah,
fun.
sure.
So yeah, I'm looking forward to continuing to build a life here and expanding the world's knowledge of osseointegration, educating the masses as best I can.
Well, you do it in a great way. And again, I want to remind everyone on TikTok at Gini Thomas and Instagram at Slim Ginny. Ginny, thank you so much for taking time to be on the We're Not Stumped podcast. I really appreciate it. I love all the great things you're doing and continue to do it. I don't have to tell you that. You're going to continue to do it. And thank you so much.
I appreciate the time. Thanks for having me on.
Thank you for listening to this episode of the We're Not Stumped podcast. I have an ask for everyone that got to this point of the podcast. Please like, share, and subscribe. The reason is simple. These stories need to be shared. It would help it to get out there to the people that really need to hear these stories.